in the afternoon on Wednesday, July 22nd, 2020. My name is John Bernstrom. I'm the Public Information Officer for the City of Grand Forks, and welcome to our afternoon press briefing. We'll get things started off today with Mayor Boczynski. Mayor.
Thank you, John, and thank you to all of those that have tuned in today. With an uptick in case numbers worldwide, I think it's important for all of us to feel grateful that we live in a city that has handled the pandemic very well, and we've kept numbers low. Now is not a time to panic. It is a time to prepare. We are preparing as our university students return to campus and as our young ones prepare for the upcoming school year. On our panel today, we're also going to have Dr. Deer with the Altru Health System and Dr. Wynn over at the UND Med School. And he's also helping out the state of North Dakota now. And also Ms. Deb Swanson, Grand Forks Public Health Director, will be available for questions at the end. John, you can pull that slide up. We're going to start with the COVID numbers. Today, Grand Forks County has 6 additional cases to add to our COVID-19 count, bringing our total positive cases to date up to 555. Of those, 449 individuals have recovered. We've had 4 deaths, and 102 cases are active and are currently being monitored. We held our largest testing event last week. It was a general public testing event held at the Alaris Center on Wednesday. It was open for 7 hours. We averaged 230 tests per hour while we were in full operation. And the total number of samples that we sent out to the health lab with the state were 1,596. Ms. Swanson, the health department, did a great job. 49 of those total positive tests were across North Dakota counties. This does not include any tests that may have been positive for people living outside the state. So we ended up with 42 in Grand Forks County and 7 came from outside the county. And as I mentioned before, the support and logistics were provided by Grand Forks Public Health, Grand Forks Public Works, Grand Forks Emergency Management, the Police Department, Public Information, and the National Guard, as well as the Salvation Army was out there with refreshments and food and stuff for the volunteers. I thought that was great to see them out there as well. UND is currently holding a test today. It's open right now. It's been opened up to the public until 5 p.m. Or until tests have been exhausted. So if there's anybody that wants to get tested, go over to the High Performance Center before 5 o'clock. This is a walk-up event. Face covering or masks are required and 6-foot distancing is expected. If you get a chance ahead of time, please pre-register at www.testreg.nd.gov. We'll put that up on our Facebook page too, to give people a chance to look at it. We've been working very hard with our institutional partners, along with the City of the Grand Forks, UND, Altru, the Air Force Base, public schools in the county. We meet regularly. We're making a lot of progress on our restart plans. We're pretty excited about the movement that's been happening there. We have some real cohesive community-wide strategies, and we have strong relationships across the state and the community. We still need to talk about prevention. Residents and businesses must take personal accountability to be informed and take actions based on common sense and wise judgment that will protect the health and support our economy and workforce. I'm emphasizing and encouraging individual responsibility, not only on the basis of personal safety, but for the sake of others. While asking our community to act with empathy and compassion for others' decisions and actions. Still, the most powerful weapon currently against the virus is physical distancing. When physical distancing cannot be maintained, wear a mask. We highly recommend wearing a mask when physical distance cannot be maintained. At this time, we at the City of Grand Forks are not going to mandate mask wearing. Enforcing such a mandate is nearly impossible, and without enforcement, a mandate simply becomes a recommendation. Individuals and private businesses have stepped forward, and they're making their own decisions, and we support all of these decisions. Let's be respectful of others' space, masked or otherwise, and also be respectful of business safety guidelines, whether that is directional signage or mandatory masks. Face masks lead to less viral spread and possibly less burden on our hospital system. Continue to practice protective hygiene and cleaning. Stay home when sick, wash your hands with soap and water for at least 20 minutes or as frequently as possible. Use hand sanitizer after interactions with people or objects. Cough or sneeze into your elbow, not your hands. Clean high-touch surfaces regularly. Avoid touching your face. Refrain from handshaking. We need to continue to protect high-risk and vulnerable population, which I think we've done a great job, and we need to keep doing that. With that, I'll introduce Dr. Deer with Altru. and let you take it from there.
Yeah, thanks for having us on, Mayor Wojcinski. Not a lot has changed in messaging since the last time we talked. Basically, you recapped everything that we've been stressing from the onset. The messaging across different areas has changed, and I think we're a little more cohesive now than we ever have been. We all are on the same page. We want our businesses to stay open. We want all of our community members to stay safe. And we want our health system to continue to operate functionally as it is currently. We're able to be operating full with our clinics. We're able to be operating full with our surgical procedures. We're giving all the care that our community needs at the current time. What we are worried about is if there is a potential surge. The surge would obviously not happen right away. You're going to see a lag as you see increased community spread before we see an uptick in cases. We're hopeful that the community hears our messages and they continue to follow recommendations that you just laid out, and we've continued to say on a state, local level. So thank you for having us on. We'll be open for questions.
Thank you. Dr. Nguyen, please.
Thank you, Mr. Mayor. Nice to chat with everyone. I think the mayor nicely outlined the issues and the approach. What we at UND and throughout the North Dakota University system are trying to do is to restore the in-campus experience for our students. We know that students prefer that. And while online has been a wonderful addendum to what we're doing, it is not what most students prefer as their primary way of getting educated. So we are looking forward to welcoming students back to campus. But to be able to do that safely in this environment requires all of us to follow the things that the mayor outlined. You know, there are two qualities, I think, that are very important in the North Dakota culture. The first is personal accountability, the sort of the rugged individualism. But there's also the fact that we typically live in relatively small neighborhoods and we care for and look after our neighbors. So I think it is important when we think about the various things that the mayor went over is that you're doing this not just for your own well-being, but even more importantly for the well-being of your colleagues, of your neighbors, of your parents, of your children. At UND, where we have students who are coming from not only Grand Forks, but other parts of the state and the region, as they come together, the risk will increase that we will basically import some cases of COVID. Thus, it is important to follow the guidelines that have been laid out. Again, it's not simply for your own health, but it's even more importantly for the health of your neighbors, your colleagues, your teachers, your children. So we ask you to do these things, not only for your own personal well-being, but if anything, even more importantly, for those around you, particularly in the greater Grand Forks community. So we look forward to the start of the fall semester, but we also look forward to all of us doing our part to keep this pandemic at bay. So thank you, Mr. Mayor, for asking me to be on. And at the appropriate time, I'll be glad to try to answer any questions. Nice to be with you today. Thank you.
Thank you. I think, John, the best thing now would just to be to move forward to some questions. So go ahead and take it away there.
No problem. Thank you, Mayor. Our first question today will come from Neil Carlson at iNews. Go ahead, Neil.
Hi, this is for the mayor. I guess since leading health officials are saying that wearing a mask does help in reducing the spread here, and it sounds like that's something you agree with. For those on the side of the argument that there are those on the other side of the argument who don't even believe this exists or is happening, don't they need a push to make this all effective for everyone?
Yeah, that's exactly what we're recommending and educating. People need to judge their risk level based on not only their personal risk, but those around them. So I believe that it's government's responsibility at this point to educate and to recommend.
Thank you, Mayor. Next question comes from Joe Bowen from Grand Forks Herald. Go ahead, Joe.
Yeah, hey there. Is anyone from the state health department on?
We tabbed Mr. Wynn as representing both with his new position now at the State Health Department.
Okay, perfect. So it sounds like there's a difference in the way the state, North Dakota, and a lot of other states calculate the percentage of positive COVID tests. Can one of the health experts here delineate the difference between the way North Dakota calculates the percentage of positive tests and the way that it sounds like pretty much every other state and Johns Hopkins does?
Which of the Joshes do you want to do it?
Let's start with you, Mr.
You guys
Wynn.
can flip a coin, whatever works.
Josh, do you want to take it or do you want me to?
Yeah, you can take it from a state perspective.
Okay, well, first of all, let me just emphasize that I do not speak for the state. I do not have a position at the Department of Health. In addition to being the dean, my other responsibilities are as task force director for the university system and as chief health strategist. So I have no position at the Department of Health. Having said that, Joe, to answer your question, the two calculations that are done are to calculate the number of positive tests divided by the total number of tests done or divided by the total number of what are called unique patients. That is, there are individuals who get tested multiple times, particularly those working or living in extended care facilities. And North Dakota has been clear, in my view, of the way it calculates the positive rate. But as you indicate, some other states do it differently. What I would say is the important thing is that it's very straightforward that North Dakota has made the way it calculates its positive rate very clear. And these are just different ways of presenting the same data. So again, it's the number of positive tests divided by the total number of tests done or the number of unique individuals who are tested. And unique individuals means that someone who has been tested multiple times still counts as just one person. So there are some differences, but what's important is there's no obfuscation here. There's no hiding anything. It's just different ways of looking at the data. But thank you for your question, because I know that has caused some confusion.
Thank you, Dr. Wynn. Next question, Mr. Neil Carlson at iNews. Go ahead, Neil. Neil, you need to unmute yourself.
Okay, now you should have me.
Yes.
I guess the same thing for Deb Swanson. I guess what's your position on whether or not there should be a mandatory mask, as state or national officials say that's the way to go?
Hey, Neil. At Grand Forks Public Health Department, we really like to lead with the science. And what we do know is that masks or face coverings are being shown to be really effective at preventing the spread. So I would agree with everything that's been said relative to the importance of masks when you're out and about. And the real important thing about masks, as has already been articulated, is that it's very, very helpful to protecting others. Protecting others is what we need to do in order to be able to effectively open our schools, keep our essential workers working, and ensure the safety of the healthcare workforce, the public health workforce, and especially the long-term care workforce. And those individuals the latter group are really able to protect themselves in their workplace, but it's a little bit harder for them to protect themselves when they're out and about in the public if others are not masked. So yes, we absolutely recommend it. The decision on mandatory masks is a policymaker decision.
Question from Mr. Joe Bowen. Go ahead, Joe.
Hey again. So thanks for that, Josh. Why does North Dakota calculate the percentage of positive tests that way? Because it seems like, again, you said some states. It sounds like it's not some. It sounds like it's pretty much all states calculate it the other way. Plus a lot of health experts at Johns Hopkins. So why does North Dakota do it this other way? Like, what are the advantages?
Yeah, so that's why I gave my disclaimer about not being from the Department of Health. I can't give you the rationale or why we do it a specific way. But I can tell you, as someone who has spent a lot of time in science, that the critical thing is for you to define your parameters. And that in my prior answer to you, I indicated that the state has been, or the Department of Health has been very clear about the way they do it. And I think there is a conceptual difference of whether you do it on the total tests or just unique individuals. And in the short time that I have to give an answer, to give examples of how one can be misled in each case would take a little while to do. But it's important that the definitions are there. By the way, if you want to do it, or anyone who wants to do it, the numbers are straightforward in the on the website, and you can go ahead and do the calculations right there. So the numbers of unique individuals and total tests done are right there on the website. So I would encourage you or anyone who is participating in this to go to the North Dakota Department of Health website and actually look at the numbers for yourself. They're all right there.
Thank you, Dr. Nguyen. We're on a bit of a tight time frame today, so I got time for two more. So go ahead, Joe.
So Brandon, you were saying a mask requirement would be impossible to enforce. Why is it impossible?
I took advice today when I talked to Chief Nelson about the enforcement policy, or how it would be possible to try to enforce this. I think if you look at a lot of different scenarios, are we going to see 3 cars at our neighbor's house and we're going to call the police and have them come, and then everyone puts a mask on before the police get there? Are we going to have police roaming the streets looking for people without masks? There's a lot that would have to go into trying to figure out a way to do that, and we're not at the point where we're even going to start going down that path.
Thank you, Mayor. One other question here. I just unmuted you. Go ahead. I'm not sure your identification there. Go ahead. It's labeled DB. All right, they're not going to. All right, they're not going to talk. We'll go back to Joe. Joe, go ahead.
Sorry about that. So this is one of the questions we got from Facebook here. Under what circumstances would Grand Forks or Grand Forks County or whoever require bars or restaurants to close to in-person service again? Like, what's the threshold there?
Well, I guess I could speak for the city side, but right now we do not intend on closing any businesses up to this point. If we get superseded by state or federal government, then we would do it. Outside of that, there's a lot of data, a lot of different moving parts to be able to set an exact point of when we'd be closing businesses. But right now, we don't intend to at any point. And if anyone else wants to answer.
Anyone else want to jump in on that one? We'll have that as our final question. If not, thank you to Dr. Deere, Deb Swanson, Dr. Nguyen, and Mayor, if you'd like to have the closing statement, please go ahead, or else we can have it right here. The Mayor's press conference is in about an hour.
No, well, I'd just say thank you to everyone. I know we're all kind of waiting patiently to hear from the school, from the public school system on what their plan is. When we have that, I think we'll probably do another press conference, and we'll get Dr. Brenner on here to explain what their plan is. But until we have that plan available, there's really no point in speculating. So outside of that, thank you for the panelists. Thank you, Ms. Swanson, and the press, anybody else watching. Have a nice day.
Thank you, Mayor. Good afternoon, everybody. Have a good one.